right. My name is Lori Grough, and I'm the owner of Shoreside Therapies. And today we have Elizabeth Malchow. Nailed it. I nailed it.
Nailed it.
Yeah.
You did.
Today, Lizzie and I are going to talk a little bit about her work with clients and get an idea of who she wants to work with, who's going to be a good fit, and just so that you get to know Lizzie a little bit better.
Thank you. Thanks for having me.
So, what is your approach to therapy? What are some of those techniques that you generally use?
My approach to therapy is completely centered around the client's well-being, the client's experience in the room. I take a very warm, collaborative approach. I always want the client to feel like they are in the driver's seat and I am a guide. It is their space. So I'm very client-centered in that way. I'm very devoted to creating a safe space. That is my number one priority. I take client rapport very seriously. I want everyone to feel very comfortable in this space. And I work very hard to maintain that very open, non-judgmental space as well. In terms of techniques, I think something that's very cool about being newer in the field is I am learning what techniques work best for me, but really my job is to determine what technique works best for my clients. I try my very best to adapt to what I'm hearing clients say, and then from there kind of think, what approach would best benefit this situation, what I'm hearing. That's kind of been how I've been operating, and I think it's been really great. I think it allows me to consider all of my options, and then also I do try and ask the client, "Hey, is this fitting for you? Is this resonating with you?" to make sure that the work we're doing is benefiting the client.
Right.
But yeah,
Yeah.
I wouldn't say I have like a set in stone technique or framework. I think it's more so just I'm dedicated to using whatever benefits my client because I have training in all of the areas. So using my knowledge to help my
Yeah.
clients.
Yeah. So,
Yeah.
Lizzie, one of the things that we've talked about is how you've used all of the different types of therapy as far as now I can't think of it. We were just talking about
Act.
it yesterday. Yeah, act. Why am I I'm like, is it
You
act?
had
I
it.
want to say art. Why am I saying act? Yeah. So you integrate act, muscle
Mhm.
relaxation, attachment theory, are there and CBT, I know those are the ones that come up,
Mhm.
but really under that client-centered focus, which is incredible, right? You're focusing in on what's gonna work for this particular client and not
Mhm.
necessarily just holding on to that one
Mhm.
type of way to do therapy, which I think is really impactful for that client. And you said something else I just wanna stop at and point out, and that's that you're checking in with the client. Is this
Yeah.
working? What's working, what's
Mhm.
not working. And
Yeah.
one of the things that I think really helps a client is being able to have that communication with their
Mhm.
therapist and feel like they are in a good, safe spot for that, right? And we don't get to
Yes.
determine if it's safe or comfortable. Client
Mhm.
does. But
Exactly.
if they are safe and they are feeling like I can say this, a lot
Mhm.
comes just from that moment on, right? When that trust is built and then they can say, "Hey, what we talked about last time, I don't know if that sat well," or "I'm not sure if that's gonna
Mhm.
work with me," and that you can meet them at that and ask them more about what's working, what's not working.
Mhm. Absolutely. I couldn't have said it better myself. I think as a therapist who's also been in the client chair, that's something that has always been super important to me. I know what it's like to kind of have something not quite hit the mark, and then it's in that weird situation where, "Oh, do I speak up? Do I say something?" So I always let my clients know, "Please let me know if something's not landing. I will never be offended. My job is to give you what you need and to be here for you in a way that makes sense for you and that feels approachable." And I always want to make sure the type of work we're doing is at an appropriate pace for the client. I think as you work through things, that's another factor. Client needs to be comfortable and growth needs to feel approachable and not scary. And I think that's one way to do it, just checking in with clients and making sure that they are benefiting from the type of work we're doing. Because the cool thing about therapy is there's always another way to go. So That's something I try and keep in mind. There's a lot
I
out
love
there if
that.
something isn't working for them. Yeah.
Yeah, there's always another way to go. I love that, and just in general, how useful that is as a way of moving through the world, right? Is that there's other perspectives, there's other options. One thing doesn't work. We know that, right? One thing doesn't work for
Mhm,
everybody, you know. So I really, really think with that client work, if somebody's able to have that conversation with you, change can
mhm,
happen with that. Even that in itself, right,
definitely.
might be a unique first time experience for somebody.
Definitely.
Mhm.
Abs
What are some of those areas that you're feeling drawn to right now?
Yeah, um, I am loving this beginning phase of my career because 'cause I'm able to get so much experience in so many different areas. I think the sessions and the clients that I feel most connected to are very much clients who are going through some sort of life transition, clients who are seeking out identity development work or processing. That's something that has been a really, really great area for me to work in. I'm also very drawn to people pleasing, like that behavior, working on that with clients. So I'm glad you brought that up. Stuff like that. Again, I love working with any set of problems. I'm very interested in trauma processing work. That's something that's big for me as well. At the moment.
Yeah,
Yeah.
and I would love to hear too with that identity piece. I know it's something me and you have talked
Mhm.
about.
Yeah.
What are some of those things you notice are the problems that a client's coming to when they're saying like, "Oh, I'm
Mhm.
I'm in this transition. I'm not sure where to go." What are some of the things that they might say or be struggling with?
Yeah, I feel like it's definitely an issue. I've seen it across different age ranges. I don't think it's necessarily, I think a misconception is that, life transition stuff will happen in your 20s and then it won't happen again. But I've seen it at multiple different ages since the time I've started doing this job. So I'll put that out there. I think it's something that can apply to everybody at any stage in life. Something that I see a lot is people who are struggling with enjoying their job all of a sudden. That's something that they used to enjoy and now they don't. And it's kind of a matter of, do we know what our values are in this moment? How confident are we that we have a solid understanding of what matters to us? And I know that kind of sounds like, duh, but it very much isn't. And values work is so heavily tied into all of my niche areas that I think values are very important. So I see it with jobs. I see it with people who are going through relationship changes, whether that's friendship changes or like intimate relationships. I see that happen as well, where people are noticing that change in themselves. And then all of a sudden it's coming out in relationships in a way of, I'm not feeling so compatible with my friendships right now. Cause there's a lot of harmful internal narrative that can come, a lot of negative self talk that can come up when that starts to happen is, oh, am I a bad friend? Or I can't keep friends or I can't be in a relationship when in reality, what values are changing? Are we simply growing out of these relationships? Are we maturing out of them? Exploring other perspectives. What might that mean? That's kind of the biggest areas in which I've seen transition work, but it's
Yeah,
really
Lizzie
amazing.
yeah, Lizzie, with that, like, one of the things you and I feel like connect a lot on and have some similarities is that values component of because we it does seem like in some ways, like you said, really simple of like, well, yes,
Mhm,
these are my values, but actually when you start really thinking about what are those things ultimately that matter most to me? Am I doing those things in my life? Or
mhm,
or is it like in complete opposition? Or is it a blend of two? You
mhm.
know, it can be across the board a lot of challenges with that. And it's something that we
Absolutely.
might get at like maybe at a meeting with our work, right? Where they say, here's a value list and put those out. But with some of the things that I've seen you do and our work together, it is much more than just looking at a list. It's really about
Mhm.
what do those words mean, right? Like if friendship is
Right.
number one, what does that actually mean? Right? Does
Exactly.
it mean I drop everything for my friends when they call? Does it mean, that I'm gonna spend time with them once a week? What actually does that
Mhm.
mean and what do you want? in that area. It's much more detailed.
Yes.
And the nice thing is though, when someone's working with you, they can experience that understanding of what they truly want, what are some things that are getting in the way of those things, and how to build the life that they actually want, not what maybe society says, maybe friends and
Mhm.
family say, but they have a real grounded perspective in what they want for the rest of their life or temporary. Maybe it's just for this next year, you know?
Mhm.
That
Yeah.
changes, right? For my
Mhm.
summer, for instance, my value is gonna change. It might be more beach time than it would be normally, or more time with
Mhm.
kids than it would be normally. But
Mhm.
just kind of paying attention to how we match up to what we really want. So I really think that's incredible.
Absolutely.
Yeah.
Yeah, and I
Awesome.
think that's kind of why, like, ACT is so great in so many
Yes.
ways, because it's exactly that. Acceptance and commitment therapy is a framework that I do really enjoy because it's tackling that, are we experiencing that psychological tension because we're not acting in line with our values, and what can that do, and how can we approach things judgment-free, whether it's opinions about ourselves, thoughts we're having. I think those are all like, that's an important step to learning how to be honest with yourself and how to be vulnerable with yourself. That's a skill, and that's another piece of the work that I absolutely love as well.
Right, right. Right. I love
Yeah.
that, being honest with yourself, right? So some of
Mhm,
it's that, and some of it's awareness and putting it all together.
mhm.
Yeah.
Absolutely.
Speaking of ACT, this wasn't on my notes, but I do wanna share a little bit because people don't necessarily know a lot about that type of
Yeah.
therapy, right? A lot of times people are talking a lot about EMDR and CBT, and, maybe people are talking about ERP, but really
Mhm.
ACT is, I feel like it's a really under talked about therapy
Mhm.
approach. Could you give just a little bit of an overview of that?
Yeah, and I'm actually so glad you said that because I agree. I think it's very you hear a lot of the classic, like, CBT, DBT, all the lovely ones you just mentioned. I do kind of find myself conceptualizing from this framework a lot and kind of working through what clients are saying to me through this lens. I don't necessarily apply it to every client in terms of treatment, but just for an overall view on ACT, it's really focused on the idea of psychological flexibility. This is, exactly what it sounds like essentially. It's your ability to remain present through difficult situations and difficult feelings, the ability to understand your values, know what they are, and be able to take actions that align with those values. It's not focused on getting rid of uncomfortable emotions. Instead, it's focused on helping clients change their relationship with uncomfortable emotions so that they're no longer dictating their behavior in a way of it's going to allow you to succumb less to those uncomfortable emotions and take actions that are more in line with your actual values. The goal is really to help clients like build a meaningful life, feel safe, feel secure, feel structured, even when those negative thoughts, painful thoughts, feelings, or experiences are happening at the same time. How can we kind of increase tolerance? So, kind of the narrative there is the problem's not necessarily that we are experiencing pain. The problem tends to be that internal struggle, like that urge we have to avoid it, to suppress it, to control it,
Yeah.
to fight it. How can we let that exist and accept it for what it is? Type of a
Mm,
narrative. That's kind of the best way I would explain it, but
yeah.
it's a
Explained
great
so
framework.
well.
Yeah.
It's yeah, you explained it so well because we are built that way as humans to
Mhm,
avoid pain, like, number
mhm.
1, right? So,
Yep.
if we really
Why
look at
wouldn't we
some.
want to?
Yeah. Right,
Yeah.
right, and I think going into
Mhm,
that transition idea of what we're talking about, that's
mhm.
part of it. Like, when and I'm
Definitely.
I'm thinking just right now about not necessarily my age group, I'm a bit away from retirement, but one of the things that is often talked about is like, "Oh, I can't wait till I retire." I can't wait till this. And really, with some of those statements, it's because there's a belief that there's not going to be stress, there's not going to be pain, there's
Mhm.
not going to be obstacles. But you talk to anybody
Absolutely.
that's retired and ask
Yep.
them if it's just complete paradise all day long. And I'm guessing the answer is no. And I think my mom and her fiancé and my in-laws would say the same of like, "Yeah, we're just in a different life stage with different
Yep.
problems, different pain
Yep.
points," right? And so when you're really looking at it with ACT, you're not the goal is not ending the pain,
Mhm.
right? That's not really the goal. It's that how are you interacting with it? How are you feeling throughout that obstacle? Are you trusting yourself? Are you feeling very, like you said, like structured? And that
Mhm.
that that feeling, I think, sometimes goes away during transitions, for lack of a better way to
Definitely.
explain it. It's like, oh, all of a
Yeah.
sudden I feel untethered. I'm not sure
Mhm.
what I'm bouncing up against anymore. Like a
Mhm.
example would be a horrible boss, right? Now that horrible
Mhm.
boss is gone, now what am I bumping up against? And you can
Mhm.
kind of feel very uncomfortable to or untethered in that situation, unattached. And that is really scary for people. And that's what,
Definitely.
partly why change is.
Mhm.
So, no.
Absolutely.
Yeah,
Yeah. I couldn't have put that in better words myself. I think it's very I think, with that type of niche with those niche issues that I kind of am drawn towards, I do think ACT is very complementary. I think it's very much that idea that everyone hears all the time, but it's like, if you're uncomfortable, chances are you're growing. And how can we change that narrative of how can we fight the desire to give ourselves comfort all the time when, transitions require growth and they ultimately probably require a little bit of discomfort. So, how can we accept that for what it is and almost like have appreciation for that? I think it's interesting.
yeah,
It does kind of sound off-putting when you hear it, but I do think you're right. It's part of life, and how can we best equip ourselves to navigate these types of changes? Because 'Cause you're right, they don't stop. They just look
yeah,
different at
yep,
different points of life, but it's not like there's
mhm.
an end point. But yeah.
Right, right, exactly, yeah, I mean, there's
Mhm.
always gonna be that pull to either the past or the future, but really when
Always.
we're thinking about what do we want and what do we, want for our lives for now, that can be a
Mhm.
totally different conversation point, like, what is that uncomfortable feeling?
Mhm.
Yes, we would want to avoid it, but it always leads to something positive to
Mhm.
some degree, right? Might not be
Yeah.
exactly what we want, but something's learned. And one of the
Yes.
things I always try to remind myself when I'm trying to learn something new is that confusion I might have, right? Or that like frustration or, what I want to have happen. All of that is necessary for the learning. Otherwise, you wouldn't learn anything. You would just already know it.
Exactly.
And I think thinking about it in that way of, like, that's what's gonna give us that next level, that's what's gonna give us a better sense of ourselves, more confidence.
Mhm.
One thing people come to us all the time is about self-esteem and confidence, and it isn't
Yes.
something given, it's not just something you're born with. I mean, maybe, I've never seen it. It's usually, right, really based
Me
on
neither.
it's
I'll let
based
you know
on
when I see it.
yeah, yes. Yes, we will definitely let everybody know when we see that,
Mhm. Mhm.
but it's built on that idea of I can get through something difficult, and so even just thinking about it that way of what's coming at the end, it's that you're gonna gain confidence, and you're gonna keep gaining confidence each and every time you're doing something that's
Mhm.
challenging. Doesn't have to be a level
Absolutely.
10, it could be a level 2,
Mhm.
but just keeping that in mind.
Right.
Alright, I love it. So
No, that
when
was
you're
good.
thinking about, like, your decision to become a therapist, right? This is
Mhm.
always unique for everybody. We all come to it for different reasons, but if you're able to share a little bit of what made you decide to be a therapist.
Yes, absolutely. That's probably my favorite thing to talk about ever. So, I would love to share. Becoming a therapist to me was not something that I did because I thought it would be easy. It is not something that I chose to do because I thought it was just like the most logistical best option for me. Because I am so passionate about this. And I know I said this at the beginning, I have been in the client chair. I have been in the client role. I have now been lucky enough to be in the clinician role. I think ultimately what drew me towards this career is I did struggle with finding a clinician who I felt matched me and who I felt very comfortable with. I did have kind of a rough time in therapy on the client side for that reason. And I kind of made a pact to myself that I was going to become what I was missing. I wanted to become the gap that I was witnessing. And it's been a long time since I had that experience, but that's truly what I've come back to every time. I think it's important for everybody to like, the more clinicians that are out there, the better it is because there is a therapist out there for you. There is. And there are so many wonderful clinicians, especially at Shoreside. I think we have such a wonderful team. It's so well-rounded and so diverse, and everyone here is amazing, but I know what it's like to be on that searching side and that trial and error side, and I never quite felt like anything was a fit for me, and that was very discouraging as a client. So I wanted to devote my life to this profession. I have grown so much personally from being in this line of work. It's been such a gift. I would love to share it with people. I have been sharing it with people. It's been going great. But yeah, just really devoting myself to being as adaptable and as welcoming as I possibly can be. My ultimate goal, I want to help as many people as I can possibly reach, as I can possibly impact. That is the goal. And really just I want to be there for them. Like this is their space. And I also want to acknowledge that when clients come to therapy, they're at a pretty low point. And that takes a lot of confidence, takes a lot of courage and strength. And I want to be a clinician that notices that. And that's really kind of meeting clients at that space of thank you for coming today. Thank you for sharing this very vulnerable level of yourself with me. I promise I'll keep it safe and treat it with care type of a perspective. But that's why I'm in this field. I think I just wanted to become what I couldn't see immediately, and granted that was years ago, but
Yeah.
that's
Oh,
kind of where I'm coming from.
I love that, Lizzie, and I think too, you're highlighting one of the things about Shoreside. So
Mhm.
I'm gonna plug Shoreside because it's actually it's one of
Plug 'em
those
up.
things where we do consults, we work a lot
Mhm.
collaboratively, which isn't
Yes.
something we typically announce or showcase as one of our biggest assets, but it truly is
Mhm.
because we can get on a call and have so many different perspectives and help in
Yes.
these situations where us as a clinician
Mhm.
might get stuck. And, and that other piece of Shoreside is at that beginning part of finding the fit. If you're
Mhm.
not a fit for Shoreside, we help you find that person because that
Exactly.
is like number one goal. Like that is
Mhm.
our I think one of our standout features is that we will
I
help you find
agree.
somebody. And even like sometimes clients will go to different therapists in our community, and just the fact that we all are so open to that and how we want to make sure,
Mhm.
hey, I don't specialize in OCD. This is somebody that would be a great fit. I work with them a lot. We talk about, it can be a smooth transition. So that's why you're just an asset to Shoreside's team is number one, because you have that passion, but also just the wealth of knowledge you have has always been impressive to me, and how you're
Thank
able
you.
to help clients really in those spots where they're struggling, they're vulnerable, and they feel safe enough to come back, even when it might be really difficult for them to come back.
Even if I'm not a perfect match for a client, I do know that with everything Shoreside has to offer and the great staff that we have, we can help you. And we're dedicated to finding that fit.
Yes. Well, thank you so much, Lizzie. And
Absolutely.
if anyone wants to reach out to Lizzie, they can do so by looking at shoresidetherapies.com, and all of your information is there. They can reach out to you via email. They can talk to Katie or Catherine to set up that appointment, but they can also book
Head
that
in the
free consult
clouds,
right
we're
online.
full
So
of
I appreciate you, Lizzie,
trials. We
and we'll talk
Thank
very
you.
wonder
soon.
All right.
the chaos, the crowds, a city that never slumbers.